The air we breathe is only about 20% oxygen, whereas high-pressure treatments, such as HBOT, promote healing by breathing in 100% oxygen. Not only does HBOT restore oxygen levels, it also aids in detoxification, prevents pathogenic infections, improves metabolism, and slows cancer growth. When oxygen levels are depleted, the body becomes acidic, allowing cancer to thrive. Hey everyone, this is Holly Knutson. I'm a health practitioner from Utah, and today I would like to continue my cancer series and talk about hyperbaric oxygen therapy, also called HBOT. This therapy has been used for several decades to heal chronic wounds, accelerate healing, and stimulate the immune system by increasing oxygen levels in the body. Recent studies are finding that HBOT has a favorable impact on cancer as well, and in this video I'd like to talk about 10 ways HBOT treats cancer. But first, what is hyperbaric oxygen therapy? HBOT is the administration of oxygen under pressure, with a minimum pressure being key to its effectiveness. Pressure at sea level is 1 atmosphere, meaning the amount of pressure the atmosphere exerts on a body. In order for HBOT to be therapeutic, the pressure must exceed this number. In fact, the pressure must be 1.4 times the pressure that is sensed at the surface of the Earth for it to be considered hyperbaric oxygen. Typical oxygen pressures used in HBOT fall within atmospheric ranges of 1.5 to 3, with around 2.21 atmospheres being commonly used in clinics that offer HBOT. This pressure is equal to 40 feet of seawater if you were scuba diving at a depth of 40 feet. Atmospheric pressures above 1.5 cost more in terms of price, but there are HBOT modalities such as Mild Hyperbaric Therapy, or mHBOT, that use lower amounts of oxygen. Instead of 100%, they use oxygen levels around 95%, with atmospheric pressures in the range of 1.3. And these therapies have a more affordable price tag and don't require a doctor's order. Most people associate HBOT as a treatment for decompression sickness for scuba divers and carbon monoxide poisoning, yet its applications are far-reaching, including treating severe forms of anemia, diabetic foot wounds and ulcers, and damage resulting from radiation treatment for cancer. The FDA views 100% oxygen as a drug. Therefore, you'll need a prescription in order to obtain oxygen treatment. Now let's talk about hyperbaric oxygen therapy in regards to cancer. The air we breathe is only about 20% oxygen, whereas high-pressure treatments such as HBOT promote healing by breathing in 100% oxygen. Not only does HBOT restore oxygen levels, it also aids in detoxification, prevents pathogenic infections, improves metabolism, and slows cancer growth. When oxygen levels are depleted, the body becomes acidic, and this is the perfect environment for cancer to thrive. And now I want to go through the 10 ways that HBOT is used as an adjunct or standalone therapy to prevent or treat cancer. HBOT works through a number of different mechanisms, as you'll see as we go through these 10 ways that it can benefit cancer and other inflammatory conditions. Number 1, HBOT boosts immune function. White blood cells function better when treated with oxygen. They also increase in number, providing more soldiers to combat pathogenic microbes. More oxygen enables the immune system to do its job more efficiently, including preventing the development of cancer. Oxygen also acts as a potentiate, meaning it enhances the effectiveness of antibiotics. Number 2, HBOT promotes detoxification. And that is there's a huge link between toxins and cancer. HBOT promotes detoxification by balancing enzyme systems in the body and increasing circulation to tissues that have been damaged. Cells that are oxygenated are healthy, and a metabolically healthy cell is much better equipped to release toxic substances and chemicals. Number 3, HBOT decreases inflammation. Oxygen is an amazing anti-inflammatory and pain reliever that reduces levels of cytokines and C-reactive protein, both inflammatory markers. HBOT is applicable for any condition that is inflammatory in nature, and it works by delivering increased amounts of oxygen to tissues that have been injured. It does this by saturating the plasma with oxygen that can then be carried to areas of damage. This additional oxygen also reduces swelling by constricting the blood vessels. Number 4, HBOT improves metabolism. Energy is made in the human body through the process of aerobic metabolism, and this process requires oxygen. Conversely, cancer cells can't produce energy through aerobic metabolism, but rather create it by fermenting glucose, an anaerobic process. An environment that is oxygenated decreases the aggressiveness of cancer cells and may even kill them. Number 5, HBOT increases oxygenation. Red blood cells carry oxygen to the tissues of the body. Treatment with HBOT not only boosts the amount of oxygen these cells can transport by saturating the blood plasma, but it also saturates the lymph fluid and bone, enabling oxygen to be carried to areas where circulation has been impeded. And better circulation accelerates healing and repair. Number 6, HBOT promotes wound healing. Increased oxygen reduces swelling by constricting blood vessels. This is significant because tissues can't heal in the presence of edema. HBOT stimulates new blood vessel formation, specifically capillaries or even new capillaries, aiding in tissue repair by improving circulation. But don't worry, more blood vessels do not promote cancer growth because that is fueled by aerobic activity. More oxygen also leads to more collagen, further accelerating healing. Number 7, HBOT treats infections. Infections are implicated in the development of cancer. Parasites, fungus, bacteria, and viruses all negatively impact immune function and contribute to the body's toxic load. Many of these microbes are anaerobic and can't survive in an oxygenated environment due to the natural antibiotic properties of oxygen. Infections can be greatly reduced by this increased oxygenation, along with the favorable effects HBOT has on immune function. Number 8, HBOT slows cancer growth. Because of their unique metabolism, cancer cells can't thrive in environments that have a lot of oxygen. Oxygen retards their growth and triggers apoptosis or programmed cell death, which is a protective mechanism to eradicate rogue cells. 28 articles on PubMed that are focused on cancer growth, angiogenesis, and metastases found HBOT to be a therapeutic adjuvant treatment for various types of cancer. Solid tumors are often characterized by chronic or acute hypoxia. Cancer cells adapt to these low oxygen environments, allowing these cells to not only survive but to proliferate. Hypoxia, then, is a causative factor in the progression of cancer and is implicated in malignant cells' resistance to conventional therapies. Interestingly, leading health authorities concur that when HBOT is used in conjunction with the ketogenic diet, tumor growth slows. Number 9, HBOT heals damaging effects from radiation. Radiation causes free radical damage in surrounding tissues and inhibits circulation by causing narrowing of the blood vessels. Impaired circulation prevents healing of damaged tissues and can potentially lead to necrosis and infections. HBOT stimulates healing by forming new blood vessels, perfusing injured areas with life-giving oxygen. It may even prevent irreversible bone and tissue loss. Oxygen is not only an anti-inflammatory, but it's also an antioxidant and is therefore an effective treatment for oxidative stress caused by radiation. Lastly, number 10, HBOT increases stem cells and helps chemotherapy work better. Stem cells are blood cells that are in an early developmental stage. Breathing in 100% oxygen stimulates the generation of new stem cells up to 800%. And because oxygen is a potentiate, it helps chemotherapy work better by directing the drug to the location of tumor growth. Well, how many treatments are required? Many conditions may require up to 40 sessions of HBOT to see results, but this depends on the nature of the illness. An HBOT treatment protocol could take up to 6 or 7 weeks to complete, and individual sessions last anywhere from 30 minutes up to 2 hours. Many patients don't notice any effects after treatment, even though lots of good things are happening internally. Potential side effects may include pressure in the ears, kind of like you get if you were to go scuba diving or on an airplane, and irritation of the sinuses. And of course, claustrophobia may be an issue for people who don't like being in confined spaces. Pregnant women, people with epilepsy, and those with high fever should not seek treatment with HBOT. In summary, HBOT is a painless, non-invasive, well-tolerated treatment that has favorable impacts on many conditions, including cancer. Oxygen reduces inflammation, fights infections, accelerates healing, improves metabolism, and has applications in regard to cancer, such as treating damage incurred from radiation, increasing stem cells, and slowing cancer growth. If you or someone you love has cancer, please learn more about this healing therapy. And if you've had experience with HBOT, please leave a comment below. Thanks for watching.